some of the most depressed people out of us are about the happiest people you can see. Depression can be a state of mind that somebody is at the moment, but also depression can be a whole illness that encompasses different symptoms. Depression can come as a result of you being exposed to some problems, maybe in the family, maybe a heartbreak. Yeah, that can cause some level of depression. And then depression can also occur due to some serious disorders in the brain. Like I said, that when you have somebody who has some form of mental illness, it doesn't mean that that person is actually weak. So don't mistake having a mental illness for weakness. When a person gets depressed, one of the easiest things that happen to them is what we call early morning awakening. They wake up in the morning feeling gloom, feeling sad. People start losing interest in things that will normally give them pleasure. Just all of a sudden, they just start losing interest. If one person has one depressive episode, there's a 50% chance that he will have another. And then when eventually the person has another, then the person has a worse episode. And then it keeps spiraling out of control. It keeps spiraling out of control until it gets to that dead end of depression, that is suicide. There are two major things: drug therapy or psychotherapy. Psychotherapy will mean just having to speak with a specialist, maybe a psychologist or a psychiatrist. Also, one very important way to deal with a mild episode of depression is exercise. Exercise is extremely important, and because one of the major reasons for having mild depressive episodes is this chemical in the brain called serotonin. Exercises can help the body produce these hormones properly, and then also having some form of diet. It's a diet called the Mediterranean diet. It consists of a lot of fish. People who will notice that have mild depressive episode, it's important to help them out. Sometimes just asking questions about how are you doing, how's your day going, how's the family. One of the things I also say is depression is not just psychological. There's a psychological part of it, but there's also an anatomical part to it. Like some people's brain are designed in a way that they do not have enough serotonin. It's important to know that if you feel something, at the point where you feel that you are not as happy as you are, at the point where you know that things that you're not getting along with life as you ought to, that point, that is the most important time to speak up.